Hi, Kellen Rouse here for another video about EMDR and healing from trauma. As usual, it's been a little while since I dropped my last video, but I'm still here. I've been working from home. I've been fortunate not to catch COVID or to know anyone who has died from it, although my little sister did catch it and did struggle with it, is still struggling with it. But I wanted to do this video today because I am about to go into surgery. So it seems like a weird time to go into surgery. I realize that, but it's a surgery that I need done, and it is a surgery that is connected to trauma, which is why I wanted to talk about it today. It's New Year's Eve. So I will be going into the hospital in a couple of hours to have pelvic reconstructive surgery, a skin tag and scar tissue removed from my rectum and perineum, and a hysterectomy, leaving my ovaries. This is all due to damage that happened when my daughter was born 24 years ago. I was not cared for appropriately. I was only 18 years old, and I now believe that my OBGYN at the time took advantage of the fact that I was young and naive, and also was possibly just inept. I had a stage 3 to 4 episiotomy. I should have had a C-section. My daughter was 9 pounds, and I weighed about 110 pounds when I got pregnant. So there was no way that baby should have ever come out of my vaginal canal. And she basically ripped up a lot of stuff on the way out. So of course, I love my daughter. This isn't about my daughter, but the fact that this happened to my genitalia after my history of sexual abuse and sexual trauma and all kinds of other childhood trauma when I was only 18, and certainly had not started really processing any of that trauma, is significant to the work that I've been doing. So I have, as I said in my other videos, I haven't really had access to EMDR, or I hadn't until October, and the numbers were looking good here where I live. Sorry, you're hearing my kitten playing around in the background. The numbers were looking good where I live, so my therapist decided to start seeing some people on a limited basis. Obviously with EMDR, you need to be in person. This thing doesn't really do it for me, and I need someone to guide me through my processing sessions because they are extremely intense, and I need to go inside, really go in to make that happen. So she started seeing me, and we started to work on some things that we had left off on. One of those things being my father's death, which the 10-year anniversary of is coming up on January 3rd, and is something that has been an issue for me, that is beyond the sort of normal grieving that a person would do for a parent dying. I then went to my OBGYN and found out about a lot of issues. I went for an issue that I was having and found out about a lot of other issues. So it's sort of like taking your car to the mechanic because you think one thing is wrong, and then coming back with a whole new car, whatever. So that's what's happening. So I was being triggered every single time I went to a doctor's office to address this. I was being triggered by anything that had to do with this. If I got a phone call, if I got an email, seeing the paperwork that I had at home, the notes from doctors, prescriptions that I went ahead and had filled ahead of time so I wouldn't have to deal with that kind of stuff after surgery. And I was dissociating in the hospital, or sorry, not in the hospital, in the doctor's offices. So I have 3 surgeons who will be working on me. Sounds crazy. It is a little crazy, but I'll have 3 surgeons working on me. So that means I had 4 pre-ops. I had 1 for each surgeon and then 1 for the hospital. So every time I went to a pre-op, I was dissociating to the point that I could not remember what the doctor was saying to me when I got home. And, fortunately I was taking notes and things like that so I could go look back on my notes, but I was crying, in every single visit. It was horrible. And so what this did is it let me know that there were some things about, most likely about the birth, my daughter's birth, that I had not fully processed. So even though we had done a couple of sessions processing that birth, it was an extremely traumatic birth. Fortunately, my daughter and I both made it out alive, but she was in danger. I was very badly injured. It was not a normal birth, if you will, and I never had any other children after that because of this. Finding out the extent of the birth trauma was very challenging for me, and this was bringing up a lot of things that I clearly had not processed and that were triggering to me. So I went. My therapist, who is a goddess, and please excuse me, my brain. I've been on like a clear liquid diet for 2 days, so like my brain fog is real. So I talked to my therapist and she said, look, this is an emergency. I'm only going to see you. Because she opened her practice up for like a month, and then the numbers for COVID were going up again and she went back to telehealth. But she had 3 or 4 sessions, only with me. I was the only person going into her office and the only person she was going into her office for. So I am eternally grateful for this therapist. She is an angel. And we were able to process some things. And the last thing that we processed was the hardest. And it was one that basically fixed the reactions that I had been having every single time I went to see a doctor or thought about having surgery or got an email or a phone call or anything else. And that was, and I thought it was really interesting, this looping picture that I had in my mind that I had created because it wasn't something I'd ever seen. So it was an image of a knife cutting my my vagina, my perineum. And I just kept getting the cut, not seeing any blood, not seeing anything, just the knife going, started, right? Scalpel, I guess. And I didn't see this. I mean, I was, like up in stirrups having a baby. But my mind created this, and I dissociated a lot during childbirth, to the point where, I sometimes felt like I was outside of my body watching things happen. So I think this is probably part of the way that image was constructed in my mind. And so we went back and we visited that. Like, what is it? What is that? What is that thing? Because was the invasive sort of looping image that I kept getting when I would get triggered. And as we explored this and I started processing it, we figured out that this was about grief, and that something that I had done as a coping mechanism that I'd completely forgotten about until this session throughout my entire childhood was to imagine myself as an adult, right? Imagine myself as someone who is safe, someone who is free from people who are abusing me, someone who's independent, someone who's living my life for me, right? And I had created almost this alter ego, almost this whole other person who I imagined myself to be as an adult, in order to cope with the serious abuse and neglect that I was dealing with for my entire childhood. When I was cut and my baby was born pretty quickly after that, my daughter, that person died, because never in any of these sort of fantasies that I had about who I was going to be when I grew up, none of that included having a baby or being mangled in my genitalia, just to be completely frank. And so I was able to integrate parts of that person, and through processing realize that, you know, for the most part, I actually am that person. I am an adult, and I am free from abuse, and have been for my entire adult life. I've not allowed people into my life who were going to be abusive to me. I haven't had perfect relationships and perfect everything, but, you know, no one has physically hurt me. No one has sexually assaulted me, you know, other than maybe a little verbal abuse or emotional abuse every so often. That has been completely absent from my life. I have worked very hard to become independent. I am the boss of me. You know, I really am. The only thing that's different is that I have a daughter. And when I started, and my body is different than the way that I imagined, because I did not imagine being fat, and I did not imagine, again, you know, being cut and having scar tissue and all of these other things in my genitalia. But realizing that I actually am that person, and basically what I ended up envisioning was myself in like dozens of stages of childhood, from a very small child all the way up through my late teens, you know, right before I got pregnant. And these were all the parts of myself that had imagined me as an adult and who I was going to be. And I had to reassure all of those parts of me that I am that person, and that the person who I longed to be and who kept me going in some of my hardest times is me. It's I grew up to be that person. So when I was able to recognize that and kind of let go of her, of this sort of imagined Kellen, and integrate, you know, the 99% of her that I did actually become into my adult self, and then reassure all of those other ego states about, you know, the fact that I am in fact that adult, and I am capable of taking care of myself, and that this surgery is different from the childbirth. I was 18 when my daughter was born, again, you know, just barely out of my house. I'd been kicked out of my house when I was 17, immediately got pregnant. You know, I was a child bride. I got married when I was 17. I was coerced into marriage, and then had a traumatic birth and had no support. So all of that is over, right? So I had to reassure myself that, you know, I came back from that. It took a long time, but I came back from that. And now, as the adult who I imagined myself to be, who is strong and capable and smart and independent, I am now doing something to take care of myself. This surgery is nothing like having a baby. When I had a baby the last time and everything was messed up from having the baby, all of the focus was on my daughter. Very little of the focus was on me and repairing the damage that had been done to my body. That was another thing I had to process. That was actually a whole other session, the anger that I felt when my daughter was born, that I've always felt guilty about. I still like cry about it a little bit when I think about it. I've always felt guilty that I didn't feel that, like, you know, glow or whatever. Because, you know, I love my daughter. She's wonderful. Anyway, sorry. I always felt so much guilt about that. I still have like feelings coming up about it. But I realized that it wasn't about being angry at my daughter. It was about being angry at what was happening to me, and that no one was caring for me, and I needed care. So Now, after that last session, I think we had 4 sessions altogether. After that last session, where I was able to reassure all of these ego states that, I am in fact now an adult who can take care of myself, and that I'm making really great choices. I mean, I'm going to like the best possible doctors. The surgeons who are working on me are the best of the best. I'm going to be at a women's hospital. It's a specialty hospital that only focuses on healthcare for women. And, women go there to give birth and have hysterectomies and all kinds of other things. And that, I have people to care for me, and that I have money. I have managed everything that I need to manage. I have all of my medications. I have every possible thing that I might need when I get home. I have people to care for me. Once I was able to process all of that, then I was able to be calm enough to do this. So I really knew that things had changed when I went in for my last pre-op appointment, which was 2 days ago. And that was actually at the hospital, and that's where they, do a blood test and a urinalysis, and right now COVID test to make sure you're not coming in with COVID. You sign all the paperwork and all that other kind of stuff. I was not triggered at all. I was actually in a good mood. I was actually like laughing and joking with the nurses and stuff like that. And I've been able to, for the most part, I've had some anxiety, but at levels that I would consider normal for this kind of procedure, LOL costume change. I generally do these when no one else is in my apartment and someone walked in. So anyway, I believe I was saying that I feel like that I am in a pretty good place right now. I will be leaving in about 15 minutes to go to the hospital. I'll be there for 1 day, hopefully. And when I come back, I have a couple people who will be taking care of me 24/7, and other people on call, although limited because of COVID. I actually would have far more people here to help if it wasn't for COVID. And so this is a way that I am repairing trauma. I am repairing major trauma, and not just by doing EMDR and repairing the trauma on the inside, but by repairing actual physical trauma that happened to my body that also caused a great deal of psychological trauma. So I'm going into this with hope. Like I said, I'm a little nervous, as anyone would be going into surgery. And eventually I'll make another video. But yeah, that's where I am. I am having surgery, not inside surgery like the EMDR, but actual outside surgery to repair trauma from my traumatic birth experience. I hope that you guys are also healing as much as you can, connecting as much as you can in this time when we're all isolated from each other. And thank you, as usual, for watching my video. And if you have any questions or comments, you know what to do.